Hello, my name is Caitlin Boyles. I am an Indiana State University nursing student in the LPN to BSN program. This is clinical video number 2 for Community Health Nursing 444, Communicable Diseases, Conditions of the Skin, Part 1. This is part 1 of a video series aimed at informing parents of school-aged children about common communicable diseases that they may see in their children or in the daycare or school setting. Objectives. By the time we are done with this video presentation, you should be able to identify signs and symptoms of conjunctivitis and fifth disease, describe transmission of conjunctivitis and fifth disease, explain ways in which conjunctivitis and fifth disease can be prevented, discuss possible complications of fifth disease, describe care for conjunctivitis and fifth disease, and recognize when to seek medical treatment for conjunctivitis or fifth disease. If you have not already done so, please pause this video and take a moment to take the pretest. The link is posted in the video description below. Conjunctivitis, also known as pink eye. Conjunctivitis is very common, and it is characterized by redness of the eye or eyes. It can be caused by viral or bacterial infections, or by foreign bodies or allergies. Symptoms of conjunctivitis include redness of the eye or eyes, itchiness of one or both eyes, a gritty feeling in one or both eyes, tearing, irritation, swelling of the eyelids, or a yellow-green discharge from one or both eyes. Transmission. Conjunctivitis is transmitted through contact with discharge from the eye or eyes, or through contact with upper respiratory tracts of infected persons. Contaminated fingers, clothing, makeup applicators, or multi-dose eye medications is a common method of transmission. It can also be transmitted by wearing contact lenses overnight. The incubation period for bacterial conjunctivitis is 24 to 72 hours. The incubation period for viral conjunctivitis is 12 hours to 3 days. Prevention. Encourage frequent hand washing and tell children to avoid touching the eyes with unwashed hands. Teach children how to clean contact lenses properly and make sure it is done regularly. Teach children not to share eye cosmetics or personal care items such as pillowcases or towels. If your child does get conjunctivitis, you can use a hot or cold moist packs to relieve discomfort. Encourage your child not to touch their face. Wash bed linens and towels. Allergic conjunctivitis can be treated with antihistamines. Bacterial conjunctivitis may require antibiotic eye drops. Seek out medical evaluation if your child has eye discharge. Dispose of eye cosmetics and eye care items. Wash glasses frequently, making sure to wash the cloth that is used for cleaning. Discontinue use of contact lenses until the doctor says it is okay to resume. Erothema infectiosum, also known as fifth disease or slapped cheek syndrome. Erothema infectiosum is known as fifth disease because it is the fifth common rash that children get in childhood. Fifth disease is very common infection with parvovirus B19. It is characterized by a facial rash with a slapped cheek appearance and a lace-like rash on the trunk and extremities that is often itchy. It is especially common rash among kids 5 to 15 years old. Once someone has had fifth disease, they cannot get it again. Symptoms of fifth disease include a low-grade fever, muscle aches, headache, stuffy or runny nose, and a rash. Once the child develops the rash, they are no longer contagious. They are, however, highly contagious when they have the low-grade fever and the muscle aches. Fifth disease is usually mild for children and adults who are otherwise healthy, but for some people, the virus that causes fifth disease, the parvovirus B19, can cause serious complications, such as chronic anemia. People at risk for serious complications from fifth disease include individuals with a weakened immune system, such as is caused by leukemia, cancer, organ transplants, or HIV infection. In individuals with certain red blood cell abnormalities, such as sickle cell disease, this infection can cause an aplastic crisis, as it decreases the production of red blood cells. Transmission. Fifth disease is transmitted through contact with an infected respiratory secretions when the child is in the flu-like state. Remember that fifth disease is only contagious before the onset of the rash. Fifth disease has a 4 to 14-day incubation period, but it can be up to 20 days. Fifth disease typically occurs in clusters in the late winter to spring. Prevention. Teach your child to wash their hands frequently with soap and water. Teach your child to cover their mouth and nose when coughing or sneezing. Teach your child not to touch their eyes, nose, or mouth. Avoid close contact with people who are sick. This is especially true for high-risk individuals. And keep your child at home if they are not feeling well. Care and treatment. Fifth disease is usually mild and will go away on its own. Children and adults who are otherwise healthy typically recover completely. Treatment involves relieving the symptoms, such as fever and itching. People who have complications from fifth disease should see their healthcare provider for medical treatment. Please take the time to take the post test. The link is provided for you in the video description below. There is also a link to a printable handout posted in the video description below. All of the information from this video came from Communicable Disease Reference Guide for Schools and the Mayo Clinic. Thank you.